initially it was the program that drew me in, but since moving to Baltimore, I found out it really is Charm City. You know, it's nicknamed Charm City, and what I really love is that there are small pockets of neighborhoods that are very trendy, very chic. You can walk around outside, especially in the spring, summer. It's just beautiful outside with the older brick houses and trees and the parks and the inner harbor. There's small, cute little restaurants. So really I really enjoy that about the inside of the Baltimore city. And then once you're going outside, which is something we do as residents sometimes, there's a lot of nature around, a lot of hiking trails around. If you want to go to the beach, there's a closer, smaller beach. There's a really far, big ocean beach. So everything is available kind of all around, especially if you like the city life, but at the same time, not the hustle bustle of big cities, but just something close enough, yet you still have access to the nature around, which is beautiful.
I think as far as operative experience, I think that we get a good amount of autonomy from the attendings, and that they let us, really participate in the cases. We're always encouraged to double scrub with more senior residents, and so it's nice to be able to go in and learn from your more senior colleagues and really feel like you're making a difference and are a real part of the operation.
And we're very busy, like in all aspects, in general surgery, thoracic, vascular, and we see different kind of pathologies. That's why, like yesterday, for example, I did a bypass, an aortic bypass in the morning, and then did an appendectomy at night. So I like the variety that we do here.
So I think you get a great wide range of different operative experiences from those different specialties, from elective surgeries, from breast to those surgical oncological resections to the emergency traumas and vascular cases that you also get.
That really what is my favorite experience about the patient care here at Baltimore and the Saint Agnes Hospital specifically, is that diversity of patient disease processes and the patients themselves that I don't know that you can often and frequently see in most other places.
It feels good, knowing that you're doing a good job and making an impact in the community.
I think it's one of the strongest things that we have here is we're very close to each other. We're like family. We actually see each other more than we see our own family because, residents, we spend a lot of time in the hospital. Through the years, we get closer and closer. We arrange a lot of activities, go outside, restaurants, hiking. So we're very close to each other.
I feel like especially between the seniors and the attendings, from what I've observed, it's very mutually respectful. I really like the fact that all the attendings always ask what do you think? And instead of just kind of spearheading the patient care themselves, a lot of it is dependent on the residents.
I mean, I've had the opportunity to work one-on-one with a bunch of different attendings already, and I'm really grateful that I've had the opportunity to work with so many different ones and also had one-on-one OR time with them, because I know that in an academic center it would be very unlikely that I would have that level of operative exposure to an attending.
So we have, I'm from Canada, we have residents from all over the world, really, that gather here. And I think everyone comes from different walks of life and different experiences in life and in medicine. And we're all here for one purpose and one reason. First is patient care, then training and gaining the skills that we need for practice in the future as general surgeons or specialists. And because of our experiences getting to where we are today, and I think everyone's grateful to be here and to do what we do.
Honestly, I think it's a great program. We have a lot of a variety of cases, whether open, laparoscopic, or robotic.
So I think being able to rotate at multiple hospitals and multiple reputable. We rotate with Hopkins, we rotate with the University of Maryland. We go to our fourth year, we go to Children's National in DC.
You get all the operative experience that you need. You do have a high volume of cases. You get a wide breadth of experience while having people who are really supportive and care about you.